Good afternoon, everybody. I hope you enjoyed lunch. We have a really exciting panel for our post-lunch. I want to make a couple of just quick little announcements. Somebody asked for the slides. The first panel slides were in the folder that you got this morning. One of the two for the second we handed out, and we'll get the last one. We'll put it up on our website at some point. And then this panel I just handed out to everybody. So you have those. The other, another announcement is only 3 of these microphones can be on at a time. That's why we're having a problem. So you have to remember to turn them off when we're not talking, because we are videoing this with the goal of putting this up on our website, and obviously this catches it better than when we're not using it. And I was asked also about quoting people from the audience. So I guess your information will be up there because it's being videoed, but we won't quote people in the report without asking your permission for that. But we might pull from some of the slides from the panelists, just so that they know. All right, and I think that those are them. We hope that the conversation at lunch was very fruitful. After this panel, and after this panel does Q&A, we were going to stay in this room and sort of follow up on that conversation and see what we can add to it based on this, to help both Andrew, who's working on the background paper, but also the steering committee as they think about going forward and what types of potential policy recommendations can come out of this. So I have the pleasure of introducing the panel concerning other fields outside of education research. When the steering committee was coming up with the program for today and tomorrow, they thought it was really important to hear lessons learned from other fields, as we're not the only people trying to address what to do with privacy issues and our data. So the first person who will present is John Friedman. He is an associate professor of economics and international affairs and public policy at Brown University. He's used administrative data extensively, both in and outside of the education setting, including using tax data, retirement data, and healthcare data. And he will share some of those examples with us today. And Andrew actually mentioned some of them earlier this morning. So we previewed some of what he does. Brian Harris-Kojetin is the Deputy Director of the Committee of National Statistics at the National Academies of Sciences, Engineering, and Medicine, where he also serves as the Study Director for the panel on improving federal statistics for policy and social science research using multiple data sources and state-of-the-art estimation methods. The academies have looked at this issue of privacy and data broadly in several different studies, and Brian has a wealth of knowledge concerning the data that's stored and collected by federal agencies. And then our last 2 panelists use and examine data in the health fields, which we've touched on a lot in different conversations here today about HIPAA and so forth. Stan Crosley, who's counsel at the law firm of Drinker, Biddle, and Reith, and helps to lead the firm's data protection and privacy practice, is also the co-director of the Indiana University Center for Law, Ethics, and Applied Research in Health Information. Also, very importantly, I think, he co-chaired, or is the co-chair of the Federal Privacy and Security Workshop for HHS. And through that working group, they released a paper called Health and Big Data Recommendations that looked at privacy. And we're hoping that we will be able to learn from those HIPAA issues that he has looked at closely. And then last, but definitely not least, our furthest traveler for the whole day, right? Nobody can beat Norway in the room, can they? Okay. Camilla Stoltenberg has joined us. She's the Director General of Norwegian Institute of Public Health. She's the Adjunct Professor of the Department of Global Public Health and Primary Care at the University of Bergen. She was also formerly the director of the Division of Epidemiology and Deputy Director General of the Norwegian Institute of Public Health, with responsibility for development of national health registries, population-based cohorts, and biobanks. She's also written about the ethical, or I think her title was unethical, issues surrounding restricting the linkage of healthcare data. And so I think she'll have a lot to add here. And now I'm going to turn it over to John.
Well, thank you so much to Amy for that warm introduction, and to the steering committee for offering me to come talk here today. It's a pleasure to share some thoughts with you that I've accumulated over a couple years of doing work with administrative data. So I think, I'm an economist, and so I have seen over the last 10 or 15 years really just a complete transformation of how we think of the standard paradigm for doing research in empirical work in lots and lots of different fields, including education, but healthcare, labor economics, public economics. And so what I want to do is try to give you some sense of, from my experiences and those of my colleagues, kind of what are the key features to look out for when thinking about how to set up access to administrative data sets in ways that balance the needs of researchers and privacy. I'll give you a couple of examples from settings that people have worked in, and then I'll talk about, take a step back and talk about some broader important things to keep in mind as we push this administrative agenda forward. So, we're all empiricists, and so I always have liked this graph. So what this shows, we went and we looked in the four top economics journals, just because that's what we're familiar with, and we plotted in each decade the fraction of kind of micro data articles that use survey data as the primary source. And you can see that 30 years ago, more than half of articles in all of these journals did this, and that's declined quite a bit over the last 30 years, so that now kind of 25 or 30% of these articles use survey data. And what this reflects is the rise of administrative data. So here's the same plot for just looking for administrative data articles. The articles that are in neither of these buckets are experimental papers where they kind of run their own experiments. That's alive and well also. But certainly, what I take from this as a message is when I talk to graduate students, the route to writing a great paper now is no longer opening up one of our standard survey data sets like the census or the PSID or something like that, and doing what you would do. That might have been the main model 20 years ago, but those data sets just have too many problems now relative to the great value of administrative data sets. And I think the vast, vast majority of effort now has gone into getting access to and doing work in administrative data sets of varying nature. Now, I think where we actually have first seen the progress on access to administrative data sets has actually been in European countries like Camilla's data set, as we'll hear about later on today. The Scandinavian countries, Germany and Austria have been very far along in this. Even France, Italy, the UK have made good strides. And so what we've actually seen is many of the papers that 15 or 20 years ago would have been written with US survey data are now being written with European administrative data. And that's in education as well. Lots of people studying different questions about the effects of tracking in education, or the very interesting papers on the relative age effect, all being done during European administrative data sets, because it's very easy in those contexts to link education administrative data with data from Social Security registers or other registers to look at the type of long-term outcomes that is a little bit harder in the US. And I think that in the US, we're starting to develop a data infrastructure, but it's quite fragmented relative to a lot of these countries. I myself have done work in Denmark, and it's just, imagine that like census and IRS and HHS, and just everybody was in one building, and you just went in and you got access to it all at once. And it's all de-identified, and they're all very careful about it, and I'll give some more kind of detail about how they do that later on. But this kind of fragmentation that we see here that makes it hard to link one data set to another is just completely absent over there. And so what we've seen from this is, obviously in education, but in labor market research, patents and innovation, business formation and growth, looking at Medicare, Medicaid health data. These are all areas where I think people have started to make progress in the US, but they've made substantially greater progress in other countries where there's a broader availability of administrative data. Now, I actually think, based on my experience with education administrative data, that people who use education administrative data actually have it pretty good relative to people who try to use other forms of administrative data in this country, in the following sense. My sense of the typical data model, this is not for everyone, is that you sign some MOU between a district and an individual, and then they give you the data, and that's it. And they require that you keep it on some kind of secure machine in your office, or you lock the door with some kind of fancy lock. But for the most part, you can still work with the data on a machine in your office, and it's really all quite seamless. And I think that this is obviously highly flexible and it's quite convenient. I think that people have reasonable concerns about whether this provides a secure enough environment for these data. And I think it's also, to the extent that one needs special machines or fancy locks, it's a little bit costly to replicate that in every single office. But this is actually pretty good in the sense that there are relatively few restrictions on what you can do with administrative data that you would have wanted to do if you were not facing those constraints. So suppose that we need to modify this model in some way, kind of what are the different options that people have looked at and what are the pros and cons of those models. So the first one, which I haven't even put on a slide, is something that people were talking about this morning, which is some kind of masked or some kind of data set like the statistics of income samples that they put out from IRS, where they try to give you like a fake individual data set. It looks like an individual data set, but they've carefully masked things in ways to make sure that you can't actually recover information about any given individual. And I think that the broad experience from those data sets is that they're totally fine if you want to calculate various summary statistics, but that for lots of different patterns that you're looking for, especially if you want to try to do some form of clever quasi-experimental identification, those data sets almost always don't work. And the reason is just that identification relies on some very particular form of variation in the data. And unless the collapse or the masking has been done in a very careful way so as to preserve exactly that piece of variation, almost always you're going to swamp it and you'll never be able to recover it. And so as a result, I think that those data sets are fine to exist, but they're almost never a good substitute for actually having access to the microdata oneself. And so from my perspective, the challenge is how do we get researchers access to the microdata in a way that preserves the research flexibility and lets them work in as normal a way as possible while respecting the privacy constraints. So I think a very commonly discussed model that has been used at Census for a long time and is now being expanded is the Federal Research Data Center model, the federal RDCs. Right, so this started for researchers to look at confidential census data and has now been expanded to include data from a number of different agencies. HHS has some data over there, DOJ, DOL. And the model here is that researchers work in a dedicated closed system. So you go into the room and you can't access anything on the outside. And you can do whatever work you want to do. Oftentimes, even the data in there have some kind of masking. You can use mostly de-identified data in the sense that it's individual data, but it doesn't literally have the names on it, except you can get access to that in special circumstances if you want to merge on outside data. I think the pros for this is that they have all these data centers around the country. And so if you happen to work near one of these things, you can just go in and you can use it. There's a pretty regular process for applying for access. It's not the most convenient thing, but you can get access. I think the problem with this model is that they've cordoned off the access to the microdata to such an extent that it's very difficult to do the kind of iterative process that normally occurs in research. So normally, you want to go run some regressions, you want to show them to your co-author, you get some feedback, go in and run some more regressions. This model requires human review of anything you want to take outside of the data center. And so this type of iterative process is enormously slow when trying to use these. And so basically you can collaborate with somebody who's also inside one of these data centers, but it's very difficult to kind of send things back and forth quickly, even if it's just regression coefficients off of millions of observations in a way that presumably doesn't really set off any privacy bells. Now, another model that I've worked with is the model in Denmark. And I think this is a very common model for European agencies. But the key here is there are two differences relative to census. So the first thing is that you don't have to go into a specific center. You end up VPNing from your machine into their systems. And you basically end up working on remote desktop, working with Stata or whatever you want on their machines. And so the data always sits on their machines, but it's very, very easy for you to do it without having to go into some special office to do it. You can work on it for a couple hours in the morning, then go have lunch with your colleagues and go to a seminar and then come back, and that's totally fine. The other critical thing is that you can send off collapses or regression coefficients through an automated system where there's an automated check to make sure you're not sending off something that looks like individual data. Those are then later audited by humans to make sure that you have not actually sent off individual data, but sending off regression results takes like 15 minutes. You stick it in a folder and then it shows up in your email box 15 minutes later. So it's really very, very efficient. And I think that this type of model, in my experience, has worked very, very well as a balance between we don't quite want their individual data sitting on your computer, but they've done everything they can to make it streamlined and accessible in other ways. Just another cool thing that Danes do is you get access as part of a university group. So, for instance, we had access working in partnership with researchers from University of Copenhagen. If anyone on the system violates the data disclosure rules, then everyone in your group loses access to the data for a month. And so you can imagine that your colleagues get pretty upset with you if you are the reason that they have to sit for a month and not get any work done. And in our experience, people behave themselves in that. So I think that finding some model like this that can work in the US, I think that we're a little ways away from having a unified statistical center in the US, but I think this type of model where we allow individual researchers relatively flexible access under certain conditions is a good one to pursue. So just a couple of broad keys, I think, to the sustainable data development in the US. So first thing is education, not in the context of education data, but in the sense of making bureaucrats and lawmakers aware of what it is that we want to do with administrative data. So for instance, I work with IRS data, and you might think that, wow, having researchers trolling through these things is really costly, and Lord knows what's going to happen. But hopefully we've actually managed to produce some results that help them in making policy. And we're also, I think, maybe 25 people on top of, tens of thousands of IRS employees who already have access to the exact same data that we do. So it is not obvious why we're a greater threat than all of those tens of thousands of people. I think we're moving in the right direction here with the Murray-Ryan Data Commission, but I think it's really everyone's responsibility to make sure that we do our best to make sure that people understand how important this work can be. Second, I think that it's very important to find ways to contribute resources to help support these types of things. In my experience, one of the real bottlenecks can be just a lack of resources in even super mundane stuff, like they don't have enough people to process the paperwork to get you access, right? It's some global sense, it's really silly for that to be a bottleneck, but the federal government is trying to cut back in lots of different areas, and so various hiring freezes or budget cuts in different areas can have a major impact here. And so finding ways to make sure that we can contribute resources as well, so that we preserve kind of as much access to qualified researchers, that access is driven through fair and open research competitions, to open to all researchers, including young researchers, is very important. Third, I think that having systematic electronic monitoring is very, very important. I mentioned the social enforcement from Denmark, and I think that there's human review, I think, is overkill. We want there to be a human looking at it at the end of the day, but having a human look at every single thing that's brought out, especially in this era of very tight resources, I think is not an efficient use of everyone's time. And then fourth, I think that emphasizing the extent to which administrative data can be useful, not just for research, but directly for the operation of government is very important, because oftentimes that's what's foremost in the minds of the lawmakers or bureaucrats that are really controlling or potentially working on reforms to open up these type of data access protocols. So for instance, an example that's I'm sure familiar to this group is FAFSA simplification, right? There's utterly no reason to have all the parents put in all their information separately when we have at least 2 different agencies that have lots of this information stored up in the first place. Thinking about social support program eligibility. Most of the information one needs for program eligibility is stored in some government data set. It just usually isn't the same government agency that is running the social support program. And then even simpler things like if you're trying, the census always wants to have a sense of who are the new hires in the US. For a sampling frame, it turns out that there's a data set that collects exactly this called the National Directory of New Hires. That is a data set whose purpose is to help track down deadbeat dads who need to have their wages garnished for child support. But it is not used at all to help the people that want to think about employment or hiring as a national statistics, right? So, why this data set is cordoned off in a way that, census can't get access to it, it's kind of beyond me, but it's one of the legacies of the way this very fragmented system grew up, and kind of emphasizing that, like real life aspects of government administration can be made better alongside the research endeavor, I think can really make this a shared mission to improve access to administrative data for everyone. So thank you very much.
Good afternoon. So John said everything that I wanted to say and much better, but I'm going to try and highlight a few things that have been said already, as well as maybe give you a little bit of additional broader context. So my talk is at about a 30,000 foot level here. I was asked to talk about some of these things and in terms of give you the context of how other federal statistical agencies are dealing with some of these issues. You heard Chris Chapman this morning talk about some of these issues with NCES. So I'm going to just hit some real highlights here in terms of types of data. So I'm talking about federal statistical agencies like the Census Bureau, the Bureau of Labor Statistics, the National Centers for Health Statistics. There's about a dozen or so that whose primary mission is to do statistics. They conduct censuses and surveys just like NCES does. We're talking gathering information from individuals, from households, from businesses, from institutions. So a wide variety of data. I was trying to find a good analogy for the process data that you have been talking about here, and I don't think it's a very good one. The process data that we have typically for surveys is what we call paradata. It's the call records, it's the keystrokes, it's interviewer observations. So this is kind of the process of collecting the data. It doesn't have the same substantive impact as the kinds of things you're talking about. The agencies use this mostly for methodological research. And it does have response latencies and other things like that, but it doesn't, I think, really match up to what you're looking for here. Extensive use of administrative records, and as John had alluded to, great desire for more access and better access, even from federal agencies as well as state governments that I'll talk a little bit about as well. And so the big data, quote unquote, that many of the agencies are interested in are more commercial data. These could be credit card transactions, this could be web scraping information, and things like that. Many of you, I'm sure, have heard of the Billion Prices project that was created by Roberto Rigobon and his colleagues at MIT. So that is used actually, to create a consumer price index. BLS and others are interested in the kinds of things that you can do with that. In terms of the protections that go with these data, so NCES, as well as almost all the other statistical agencies, when they are either collecting data themselves or acquiring administrative data or other sources of data, they are doing so under a pledge of confidentiality and for using this information for exclusively statistical purposes. There are various agencies have their own organic statutes that could authorize this. The one that cuts across all the statistical agencies there is SIPC. If you haven't heard of that, it's the Confidential Information Protection and Statistical Efficiency Act of 2002. You can see why I call it SIPC for short. All employees, as well as agents, I'm going to come back to this issue of agents because that's really important, because John was essentially an agent of SOI when he was able to access their data there, are sworn to protect the confidentiality of this information. And you go through training and you sign non-disclosure agreements. And the penalties for this is not just pissing off your colleagues for the next month because they can't access the data. You can go to jail or be fined $250,000. But you know, in practical terms, you know, we've never had anyone prosecuted for that. Some of the more administrative things, some of the things that are more hand slapping, I think are more immediate and more effective. It's like, oh, you left your door unlocked, well, do that again and we take away your data, is something people respond to very well. A lot of sensitive information is being collected. Here's just some examples. Obviously, none of us care if the whole world knows how much money we make, and are very happy to have that freely circulating around. There are surveys that collect information on, you know, your participation in various government programs, including food stamps and Social Security benefits and things like that, surveys on sexual behavior, use of alcohol and illegal drugs, being a victim of crime, and electronic health records, as well as, again, keep in mind that we're talking the whole federal statistical system here, proprietary business information that businesses are asked to or sometimes even required by law to provide. It's generally the case, I think, throughout the world that business data is really considered so identifiable because it's typically so skewed, or if you know anything, if you have any kind of geography or industry or size, you can pretty much pick out your competitors in microdata sets, so you won't really find any public use microdata for business establishments. So there are other ways of doing that. We've kind of been talking about this in terms of these competing priorities and tensions. Agencies, you know, are responsible for collecting and protecting this information. They're required to supervise their employees and any agents, and I didn't bring any nice little figures, but kind of like the use of survey data, their budgets in real terms have been going down. And you guys know what researchers want. So this problem has been one that has occupied the national academies, particularly I think these are all Committee on National Statistics Studies, and there's others I haven't listed here, for a very long time. We were talking this morning about, you know, how technology has changed. Well, the 1985 volume had a picture of a floppy disk, you know, for sharing research data. Kind of a classic here is the 1993 Private Lives and Public Policies. All of these are available on our website, on the National Academy's Press, nap.edu site for free downloads. Some of these, and there's been many other studies that have looked at aspects of this in more specific contexts. So I'm going to spend a little bit of remaining time trying to talk a little bit about some of the approaches that agencies have taken that's, again, highlighting a few things or maybe pointing out things that haven't quite been covered yet. Online analysis tools is something that NCES has, and I think other agencies have been going in this direction as well. So to allow researchers to be running various analyses on data behind the agency's firewall, so you're getting the statistical output from there, and so they built tools for doing some analysis. Those have evolved in sophistication over the years. Some of them range from things like the Census Bureau has an American Fact Finder, which is basically aggregated statistical data that's already been run and already been disclosure reviewed, and it's a sophisticated query machine, and you can complain about how fun it is to use, but anyway, to getting those results back. One thing I know is very popular amongst researchers is this ability to be licensed. And keep in mind from here on down, what we're talking about too is that the agency is making information available on a restricted basis. that the researcher typically has to go through a proposal, submit a proposal, come up with some, in the case of licenses, a security plan. You signed a legally binding agreement. In fact, if it's a license, your institution, someone who can bind your institution to this legal agreement, so they're actually responsible for your behavior, and if you misbehave, they can take away access for your entire university for these data, not just you personally. And again, you have to go through annual training and be certified and agree to be bound by all of the penalties that are associated with that. Remote execution or remote access is something that gets interpreted in different ways. The National Center for Health Statistics used to do this. I think they still do on some basis, where you are submitting a query. Again, it runs on their machine. They do the disclosure review of the output and email that to you. The National Agricultural Statistics Service and the Economic Research Service and the USDA have been using the NORC data enclave to do this kind of thing. So this is more like the virtual RDC, where you're able to through a VPN network, have access to the data set that they have there. ICPSR is another enclave that some agencies have put their data. John talked about, and he missed the statistical there, it's FSRDC, Federal Statistical Research Data Centers. This is building off of the Census Bureau's Research Data Network. As he noted, there's now almost 24 locations, and they keep opening more branches. They actually got money in the 2016 budget to help increase the infrastructure, to encourage and allow more use of data sets for program evaluation purposes, to build up some of their infrastructure as well as personnel, because there have been, John raised some really valid issues of it can take a lot of time to get access to those, and I think they've been underutilized in some sense. And so this is seen as one model that is very good, in which the agency can have good control over the information while allowing researchers to come in and do the kinds of analyses they want. You can bring in other data to be merged. With the broadening of this across the statistical agencies, the goal here is that somebody could come in and merge data from BLS with census data, which are things that census and BLS currently can't do and are prohibited by law from doing so. But researchers could start being able to do these things. And so there is real interest across a number of agencies in becoming more involved with this. I think they're going a little slow in dipping their toes in, but they really are committed to doing that. Denmark is a wonderful example, as he pointed out. And I think there's a lot of folks for years who have been wishing we could go to more of a virtual model. Census Bureau employees now are able to access their confidential data and work when they work from home, when they telework. And so we're starting to cross some of these barriers. Okay, if a Census Bureau employee can do it, why can't a researcher who is bound by all the same penalties and things do that as well? Synthetic data came up a couple of times earlier this morning, and I just wanted to, I don't know if it would work well in this context. I think John raised some, both Larry this morning and John raised some, legitimate issues about its potential promise and its potential fallbacks. The Census Bureau has created 2 synthetic data sets that are out there, and they have given grants to some researchers to do analyses on these synthetic data sets. The LED, the Local Employment Dynamics Program, as you may be familiar with, is a merging of census data along with state wage data from the QCW, the Quarterly Census of Employment and Wages. So this is an employer and employee file, and is incredibly rich, valuable data set that has been created. And the SIP is the Survey of Income and Program Participation. This is linked to other administrative data like IRS tax records and Social Security benefit information. So the SIP, they have a beta version out, and I think that's where the grant program has been to look at this. Once you run your analyses you can publicly access the synthetic data and run your analyses, and then when you think you found something or are ready to publish, then you can submit a request to them to run the Census Bureau to run this against the gold standard, against the real data set, to make sure that you didn't just, you don't have an R-square of 0.9 because you uncovered the multiple imputation algorithm that generated the data set. So coming back to one of the recent reports that's looked at this, I was asked to give some lessons learned from this field. So here's a panel that spent 2 years looking at these issues. And you can see this isn't their overall conclusion, but the take-home message here is that there isn't a simple answer. Our table at lunch was we were looking for the sweet spot between privacy and utility of data. This is something that many folks have looked at, so this is perhaps to make you feel better or to make you feel hopeless, that there's much more work to be done in this area, or something that's going to continually evolve with technology. And just to point out a couple of things that kind of shows the barriers that local employment dynamics program that the Census Bureau created. It took them a decade to go around to 50 states to get individual agreements with each state to get their data. And these agreements were very restrictive. And so if you actually want to do a study on those data and you want to look across the nation, well, guess what? Every one of those 50 states, just like another 50 IRBs, wants to look at your research proposal, and some of them always say no, and some of them always say yes. So this is something that is another real frustration in dealing with a very decentralized statistical system as well as a federal system. The Ryan Murray Commission has come up several times, and this is something that the statistical agencies are actually really see as a promising vehicle for getting some potential policy and legislative recommendations made and hopefully implemented that makes it easier to be able to use files like the National Directory of New Hires that John talked about, and not just keep these data in silos and get real public benefit from more researchers having access to it. Thanks.
Good afternoon, and I'm Stan. I am a highly caffeinated attorney, which is very problematic. Usually we like our attorneys kind of docile in a corner somewhere, but that's not the case right now. Let's see where this takes us. One of the other lives that I have is that Amy was gracious enough not to mention was that I was the chief privacy officer of a large research-based pharmaceutical company, Eli Lilly and Company, in Indianapolis, Indiana. A great company. I loved working for them. Was there for about 12 years as their chief privacy officer. Lilly got a consent decree for privacy, one of the first of large corporations with the FTC. And so I actually wrote the privacy policy that we got prosecuted for. But then I kind of mostly put the fire out, so then I was promoted. So that's how corporations do it. But I tell that story because it's actually interesting that consent decree was triggered by an email, right? It was a programmer at Lilly who went to Purdue. I'm an IU grad, so I hold that against them. But getting beyond Purdue, and they wrote this code that was general enough, but it populated the to-line of an email address with 700 names, email addresses, instead of putting them in the BCC line. And she sent that out. That resulted in a consent decree. I mean, really, the thing you need to take away from this from privacy is that you will all experience a privacy breach, a security. It's inevitable because everybody in your organization can give you one. And almost every one of these is caused by human error. All right? And so if you think you can escape this, it's not going to happen. So now you have to figure out, well, what does that mean? What's the consequence of this? So one of the things I want to talk about today, though, is the White House came in and they commissioned a big data report on healthcare because they saw that there was this enormous potential with big data in healthcare, but also this scary concept that anybody with an email account can give us a big data breach. And so they said, well, you guys figure out how to do this. And so, they gave this to our task force, the work group that Amy mentioned. It's a federal advisory committee, and it's on privacy and security. And so we wrestled with this a little bit. We opened it up to public comment, and these slides are pretty meaningless, this part. But we get into the problem statements, right? And so we went through, we had a series of public testimony over about 6 months. We had a couple of dozen different experts testifying on what they thought were the issues. And so here, distilled on these next couple of slides, are just a couple of the problem statements and some solutions that we came up with. The challenges to ensure the responsible use of big data analytics from increasing risk of harm, harms of discrimination, harms to dignity. What's one of the problems? Well, it's difficult to make a policy consensus around harm when we don't know what harm is, right? In privacy, one of the biggest issues we have is that no one can really say when has a harm occurred. Is it just the disclosure of the information, or is it the fact that your identity was compromised? Well, even identity compromise, that's actually a fairly rare occurrence for someone's actual identity to be stolen. Credit card theft is rampant, right? I don't lose too much sleep about credit card theft. Why? Because the credit card companies cover it, the bank and institutions cover it. I have a zero liability on that, right? As long as I look at my bill once every 3 or 4 months. Yeah, okay, so I do have some risk of credit card theft exposure, you're right. But we went through these concepts and we said, okay, so we have to come back and figure out harm. So let's put that in the parking lot, we'll come back to that. But then this next one is very interesting, right? Poor transparency can reinforce bias and unfair practices, right? The resistance to transparency with proprietary there's that word, proprietary. This came up again and again in testimony. That privacy is being used often in restricting data flow, and really underneath it all was this sense that there was this proprietary ownership of the data in these institutions. We don't want to share because, one, we don't want our competitors to know what we're doing because we don't want them to get an advantage, or two, we don't want to tell them what we're doing because we're not all that proud of it. Right? I mean, these things happen. So this came out again in testimony where privacy was used as one of these shields to say, well, we can't do this because of privacy issues or security concerns. But really there was this underlying proprietary concept, and it hit in algorithms more so than anywhere else. Right? So there are some very valid reasons why it's very difficult to be transparent with algorithms. How the algorithm, what data it uses, it's very fluid. It's an ephemeral process, but not being willing to share any part of the algorithm or the process got into proprietary issues more than it got into the inability to share. And so I won't come back to that at all, let's be clear. But I do think that this concept of transparency is something we're going to talk about a little bit more. The other problem statement, right? You have this as well. You take FERPA, you replace it with HIPAA, and this is a conversation I've had 100 times, right? You have a multitude of laws. Every state is passing these laws, has passed, will pass. I will tell you this, you are never going to be less regulated on privacy than you are today, right? I mean, these laws don't go the other way. You don't have people in Congress standing up and say, I think we should abolish privacy. It's not going to happen, right? If some privacy is good, more is better, right? You want to be the congressman that says, I was there fighting for your privacy. So these laws will go one way only. Healthcare is a great example. I'll have a chart at the end that really kind of shows this diagrammatically. But legal complexity confuses, and healthcare confuses consumers, right? Because we have this concept, again, this is going to sound like FERPA, have this concept that these hospitals and doctors and pharmacies, they have to protect my health information. But when I go out and I Google, what's this rash on Google, right? They aren't protected by HIPAA, right? So we have these clusters of entities that are covered by HIPAA and most of the world that's not. And consumers believe, oh, you know, it's health information, it's protected. Not so much, right? Not so much. But that makes it very confusing to exchange data and to say which law is applying and which one do I have to look at. It creates friction in the process. And so that's what we came about too, is there's friction that's brought about in these interactions because we have this unpredictability. I'll say one thing here too, and I think Camilla's you're going to talk about this, I believe, just overhearing a conversation, that research was kind of drug into this mix in healthcare, right? I was on a panel by the National Institutes of Health on privacy and HIPAA and research. And it was a blue ribbon panel, except for me. I kind of snuck in the back door. But there were all these incredible individuals who've done enormous amounts of research in health. The head of the American Heart Association. I mean, just incredible individuals. And we could not find a single substantive example of a data breach of research data that caused any harm or could even be argued to cause harm, right? In health, we have a lot of key-coded data. We remove a direct identifiers and it's key-coded, so that gives it one more layer of protection. And yet, when HIPAA was passed, research was pulled in at the last minute. And, well, we don't know what to do with research. We better cover it under this law, right? And we've been fighting it ever since. De-identification. My colleague at Indiana University, Fred Kate, has often said, and I really do like, I've tried to steal it, but it's all over the web that he's said it, so I can't really, but it's, data is either useful or it's de-identified, right? Yeah, in large ways, that's true, especially for health research, where we're looking at longitudinal analysis. Very difficult, right? One-way hashed algorithms, sure, you match the hashes. It's still, you lose a lot in the translation. And so de-identification and the balance between de-identification and utility and where is that sweet spot, we've talked about it for a decade in healthcare. Genetics is where it comes up more frequently than any other. But I will say that we got this concept of a mosaic effect, right? Well, what if we recombine data sets that were previously de-identified and now together they create some type of an identifiability? And so the issue here goes back to the first slide that says, but what harm? I am a true believer. I am a true believer that data is underutilized for research. I'm a true believer that privacy that matters really matters, right? Privacy set by law and regulation is very bureaucratic. The fact that you go into a doctor in the United States and you're handed a notice of privacy practice and they want you to sign a sheet that says not that you're consenting, but that you receive the notice. And that's the height of bureaucracy, right? But that was a problem statement. We have an over-reliance on de-identification. And then the risk is that the de-identification itself isn't sufficient. And then consent, an over-reliance on consent, where the individual is in control of their information. Well, pretty much every one of you agreed to the consent statement out front, right? When you walk in the door, and nothing against the good hosts of our workshop, but it says that they now have the right to use my utterances in perpetuity, right? I think there was an attorney involved because they wrote forever, and the attorney wrote that out and said, no, in perpetuity sounds much better than forever, right? But that's the point. I have no idea what what my risk is if they use this in perpetuity. I mean, I may run for Congress someday, and this is going to come back, and now I lose the race because I had a problem with in perpetuity. So this concept that an individual is in control of their information because they have somehow this transcendent knowledge of how their information is going to be used and the risk it can create, that's just not a sustainable model, right? And so let's talk just briefly, because I am running out of time, security, but the proposed solutions, right, to address discrimination, transparency with algorithms. Let's talk about how we can maximize that. What's the validity? What's the fairness? Uneven regulation, you just have to live with it, the bottom line, right? I mean, you have to find your way through. I've been lobbying HIPAA for 10 years. and we have a very little change on the research side. I think that the one takeaway that we had here that's worth looking at is the ethical data use standards. And the concept that institutions or individuals who are handling information, they're going to have to unilaterally come up with what is an appropriate use of data, right? Because we don't want to put that on individuals, on consumers, on students, on patients, and say, you decide what the best use of your data is, because they don't understand what the benefit is of the data. And so we're in the best position to say, this is beneficial, and we think this is less beneficial and potentially harmful. And so I think you're going to be in those circumstances. We're going to try and create these ethical data use frameworks. And this is just this emerging health data ecosystem that we're looking at, right? So the patient in a data network, personal health record, this is very different than, even back when I was a kid and we had, the magazines in the waiting room, the highlights, right? That was in the waiting room. Now, we don't trust the doctor as much as we trust our own network, as much as we have it. The data is flowing out. And so this concept of patient access to data has been a fairly defining concept in healthcare that shows value to the patient. So the patient's access to health data is going to be something you're going to see in the next 5 years. This is the slides that we realized about 10 years ago. We passed the inflection point where we needed more data than the laws and public sentiment would allow us to have. And the gap has accelerated every year since. And it continues to accelerate. And finally, trust. Don't kid yourselves. We cannot convince them that the things that we do are good for them. We're going to have to figure out how to gain their trust. Because trust creates efficiency, a lack of trust, inefficiency. Think of any transaction you've ever had. If you don't trust the other individual, you're going to require more information from them. If you trust them, you'll willingly hand them what they need. And that's the model that we're in. Thank you.
Thank you so much for inviting me to this meeting. I've come all the way from Norway, which is a tiny little country compared to the US, and I come from a different field, not tiny though, but still different. But coming here is very inspiring in the sense that since I do not understand or grasp all the details, I must take a bird's view, and I will try to do that here. Therefore, I've also been revising my own presentation, so I apologize for lack of correspondence between what you've received in your handouts and what you will see here, and also if I've introduced some errors into the presentation. Am I moving this one? I'll start with a global view, and that is the picture of the Sustainable Development Goals that the UN approved in September last year. They're not even 1 year old, and if any of you go into the texts underlying these global goals, all of them point to the need for data, for analysis, for research. And that goes not only for developing countries, for low-income countries or middle-income countries, it's also the case for high-income countries. So in a way, this is an opportunity to look across sectors for what are the needs for data, what data do we have, how should we use them, and how should we work to make a sort of data infrastructure system part of reaching these goals. And I'm not saying that we in this room should do it alone, but I think that these issues are so large that we should look at it in that way. Now to the Nordic countries, many people have already praised particularly Denmark, and this is an old article from 2000 with a title that I really like, When an Entire Country is a Cohort. It is about Denmark, but actually it pertains to all the Nordic countries. And altogether, there are about 26 million people in the Nordic countries, and we would have been, I think it's the 10th largest economy if we had been one country. And I think at least research-wise, when it comes to using administrative data, registry data from these countries, we could become a superpower if we were able to collaborate even better than we are already. Not that we do not collaborate, but we haven't set up a good infrastructure for accessing these data. So every time we want to collaborate, it takes about 2 to 3 years to establish the pool database, and then a paper comes out now and then. So it's not very efficient, but it is basically unique. And the uniqueness is linked to this single thing we have, the personal identification number. It's called different things in the different countries, but that means that once you're born into the country or you immigrate into the country, you receive this number and it stays with you even after death, but it doesn't stay with you after emigration. So the overall aim for this meeting, but also for much of what we do when we do research and analysis in health, is to have or develop evidence-based policymaking. We need more, better, and much faster research to do so. At least the way we have organized research in our country is that the government or a patient interest organization or a hospital needs some knowledge, and they mostly need it immediately. And then they go to us or they go to some academic institution and they say, can you get this for us? And we say, yes, we do have the data, but we don't have the funding because we have no systematic approach to actually using the data. And we have no sort of general system for how to access the data. So we say we do have the data, but we do not know when we will be able to use it. And I'll give you one example of that later on. So what kind of data do we need and what kind of data do we have? And this is a picture that I've been using for Norway and for the Nordic countries. And basically we have national registry data covering every single individual in the country. There are relatively few variables about each, but altogether, if you link these registries, there are quite a lot of variables on each person. But basically, they are, each of them, thin, but comprehensive in the sense that we're all in them. And embedded in that, we have major longitudinal prospective cohorts covering or with at least 500,000 active participants at the moment, depending on how many of them we count into this. But for the major cohorts, such as the North Trøndelag cohort study and the one that I've been working on myself, the Norwegian mother and child, or I prefer to say mother, father and child cohort study, where we have altogether nearly 300,000 participants that we follow up. These are children, 115,000 children that were born between 1999 and 2009, and their parents. And we have biological samples and extensive questionnaire data and some subsets where we have done much more detailed clinical assessments and interviews. And we also have genetic data. We have analysis of environmental exposures from the biobanks, etc. And to an increasing extent, these are also including self-reported information from the patients as we go. In addition to that, we aim to integrate data from randomized controlled trials and to combine the two approaches, the observational one in the cohorts and the registries with the interventional approach. So this is an amazing system. Now, what kind of knowledge do we need in health? We need to know something about prevalence, incidence, or distribution. We need to identify or discover causes of diseases. and we need to look at effects. And probably the last part is where most is lacking, and the last part, to look at what works, is what's most relevant for this meeting. What prevents and cures disease? What reduces suffering? What does it cost? Does it harm? What side effects and long-term effects does it have? And as I've already mentioned earlier here today, to an increasing extent, we require to use advanced methods, and methodology has become increasingly important because the opportunities for developing advanced methodologies are huge when we have such rich data sets. So we're moving from the randomized controlled trials on one hand and observational studies on population-based registries and longitudinal cohorts on the other hand, and sort of let them meet with the causal inference approaches. But I will not expand on that today, but move directly to a single example. And that is a study that we did when the pandemic flu reached Norway in October 2009. Shortly thereafter, there were media claims that the vaccine pandemics caused a higher risk of fetal death or stillbirth. And we wanted to use our registries to look at this, because we knew that there were very few elsewhere in the world, perhaps nobody, who was able to have data available to do that. We also wanted to do it in order to identify the hurdles against using our registries for such a purpose. They're set up to do so, and we have obligations in our institution and elsewhere to follow up on the consequences of a pandemic flu and of the advice that the government gave to the population on vaccination. But we knew that even though we have these registries, even though the politicians have approved them in order to use them in emergencies or preparedness situations, it may be difficult. So what did we do? We linked a whole number of registries, and I'll show you which afterwards. And we did provide the first comprehensive study on this issue. It was published in the New England Journal of Medicine, but not before January 2013, 3 years later. We found that the pandemic vaccination did not increase the risk of fetal death, that pregnant women who were vaccinated did not have an increased risk of fetal death, that pregnant women who were vaccinated had lower risks of pandemic influenza. That may seem obvious, but pregnant women will never be part of testing out a vaccine like that. So you must have these kinds of studies to follow up and see if it actually works the way it's intended to work. The third important finding was that pregnant women who received an influenza diagnosis during the pandemic nearly doubled the risk of fetal death. Equally important to convey to pregnant women and to the population at whole, not only in Norway, but globally. Now, we had identified more than 117,000 births before, during, and after the pandemic that we used in this analysis, and about 26,000 pregnant women were vaccinated, and they were part of this registry analysis. That is very hard to do without having nationwide registries. And these are the registries that we linked. It looks simple. We had a primary care reimbursement database that turned out to be very important. This is something that very few countries have access to, primary care data. We have a vaccination registry where we had actually, on an individual basis, recorded the exact vaccine that each woman had received. It turned out that only 7 counties in Sweden had that. Almost nowhere else in the world did that exist. So the situation is, there was an emergency situation with the pandemic flu, an enormous need for data and analysis, and Norway and 7 counties in Sweden were among the few places where it was possible to do a relevant analysis. And even we didn't manage to do it fast enough. Our intention was to do it by the summer of 2010, so that we could say to pregnant women, well, now we know more, we have more solid evidence that we base our advice to you on. But it took 3 years. And why did it take 3 years? Well, these registries are managed by our institute, Statistics Norway, and the Directorate of Health, 3 public governmental institutions. But we have a regular, and you're not supposed to look at the details here. This is not a genetic analysis. This is just a visual impression of what it takes to get the necessary permissions to use the data that we already had. So it took more than 1 year from we started to write a protocol till we had all the permissions in-house. And it costed us an enormous amount of money to administrate this process. And this was a case where all the different agencies were so positive. They really wanted to give us the permissions. But since regulation is so difficult, they ran into all kinds of problems. So, for example, it had to go to the Ministry of Justice because the Ministry of Health couldn't deal with one of the issues, etc., etc., etc. So these are all the agencies involved and the time they took, and they really did their best. This isn't sustainable if you want a knowledge-based society. And this is an ideal or close to ideal situation compared to what the rest of the world is in. So we should change this together. Why is it so difficult? I've really been wondering. Officially, it's difficult because it's so important to secure privacy in general and in research specifically. But in reality, why is it so difficult? Research is regulated as particularly risky, in my view, for privacy, while most of the risk probably lies in other use of the exact same data, because the data are already there for their primary purposes. So I really like the distinction that we were presented to this morning by Andrew, where he says that there's a difference between risk in education and risk in education research. Science has an impressive status in many ways and is praised for its importance for society. But does it have the wrong kind of status and wrong kind of role, since it seems so incredibly important to put the whole weight of ethical issues, regulations, and sanctions on that not so risky aspect of using data? What can we do to improve this situation? I'm not quite sure, I'll skip this, but I think we need to work towards a knowledge system, not only for health, but probably across sectors. And I'm beginning to think that perhaps that needs to be done at a much higher level than most of us have been addressing it so far, at a much higher political level, both nationally and globally. We must have and use data, and we must secure privacy. Does research have the right status, role, and understanding? Should data be considered a grand societal issue, similar to developing transportation systems, etc., across sectors at a high political level? Those are my questions for discussion here today. Thank you.
So we're going to open it up to about 20 minutes of questions for the panel and then turn to a bigger group discussion.
Stan, this question is for you. So during our lunch conversation, we were talking about transparency, and then again in your presentation, and you brought up how transparency is important, but also the use of the data is important. You gave an example of being transparent about misusing the data is not helpful. I was wondering if you could expand on that and also talk about to whom should we be transparent?
Great question. And yeah, the idea. Oh, there we go. Okay. The idea of transparency is thrown around a lot, right? It's the answer. We have to be transparent. But as institutions or as companies or as government agencies, you have to make sure you're ready for transparency. And by that I mean you should have an ethical data use framework that you're following, right? That you have the appropriate people involved who've been trained on privacy and data security, and you have the policies in place, you've committed resources to it, and then when you have a security breach or you have a misuse of information, you can be transparent about this happened even though we did all of this. But if you're just transparent about, well, we're selling the data out the back, that's okay, right? I mean, that kind of, that's why we want transparency, is to catch the folks who aren't being ethical. Right, so it is. I mean, it raises the bar substantially, and if you're not willing, as an industry, to kind of take that step, transparency is tough.
My question is also for Stan. You raised the important topic of uneven regulation and policy, which I took to mean uneven policy or interpretation of policy across jurisdictions. And I thought I heard you say there's nothing you can do about it or something depressing like that. And I want to respond in two ways. First, I think there are examples where we can point to uneven policies that have been regulated and standardized. So the first thing that comes to my mind is the reporting of dropout rates by states. States used to vary widely in how they reported the percent of students who failed to complete high school, and it was essentially impossible to compare states or even jurisdictions within states because of uneven reporting. And under No Child Left Behind, there was a mandate to standardize the way dropping out was reported, and now states all count dropping out the same way, and you can compare states. So I don't see why the same thing couldn't happen with other kinds of policies. Second, it seems to me that at least in the field of education, this is an area where we have a lot of experience, where those of us involved in this work have butted our heads against the challenge of uneven interpretation of existing policies. And so I think this is an area where we should be getting guidance from the lawyers, not where the lawyers should be saying, forget about it. So what guidance would you have on this difficult challenge? Well,
I'm an optimist in 90% of my life, and the other 10% I practice law. And I just have to say that the example that you gave is great. The dropout rates. What I'm talking about is privacy regulation, privacy law, data security law, data use laws. And unfortunately, we've seen that the only harmonization occurs is the harmonization up, right? And so the most restrictive use of information is the one everybody harmonizes to. And so you have to be very careful about how you go about your policy criteria. We actually did do some, it took us almost 10 years, but we received some concessions on HIPAA, where we could allow, there was a provision in HIPAA that said that you cannot get consent for research that's not specified. And so you couldn't say, we want to do cancer research with your information. They say, no, you have to specify the actual protocol that's going to be followed for research. And so we were able to work with them, the administration and the regulators enough that they modified that to allow us to have an unspecified future research use. So it is possible, and I didn't mean to broad stroke to say it's impossible. It is difficult, and it's very difficult in the space of data protection, data use, and data security. Because again, I said it flip, but it's really true. If some is good, more is better when it comes to privacy. It's a very difficult sell. We tried the benefits of research, right? We talk about how many lives are saved. We talk about how many deaths occurred. The NIH has a statistic that 100,000 lives are lost every year from medication error, right? From errors that could be completely taken care of by a better exchange of information, right? None of that moved the needle. It was only when we got to economics that we said, you know what, this is a huge economic burden, right? It is impairing innovation. Then we started getting traction. So safety, efficacy, death didn't move the needle. Economics did.
So following up on that, I might be wrong, but I thought that the federal government had regulatory authority in HIPAA, but not in FERPA. And so it's a matter of the federal government never wanted to enforce a common regulation across 50 states because it didn't have the authority in the ways that it does in HIPAA.
I'm not your FERPA expert here, so someone else can say yes.
It's a federal law, so the Department of, I mean, Jeff, you want to weigh in on this? I mean, it's,
I'm happy to.
HHS has authority so Congress passed the law, but the agency has the regulatory authority to implement it.
Happy to clarify if necessary. So FERPA is under the Department of Education, and it's not been enforced primarily because it's a spending clause.
Yeah, that's the key.
Right? It has nothing to do with protections, right? FERPA applies to all educational institutions that receive federal funding. It's just that unfortunately the repercussions for stepping afoul of FERPA is that you lose that federal funding. So it does not get enforced, if that helps.
I wanted to follow up on your statement, Stanley, about the proprietary algorithms. So we have a situation where increasing amount of processed data is in the hands of private companies. And they're all saying, and there are many of them here, that they would love to give access. But surely they have proprietary algorithms that are embedded in their systems. So, I mean, do you think what you're saying is generalizable beyond health? And
yeah, and I come from private industry, right?
Yeah.
So I mean, I understand the aspect of proprietary, and I believe that it helps drive innovation. But health information, even nonprofit institutions have a proprietary interest in their data. So my comment was not as much at the aggregating institutions, although they also, the corporate private industry has an interest in maintaining that data and getting value for it, but also just the institutions themselves. They don't want to be compared to one another. They worry about these things. They worry about if we share this information or reveal we're doing something that we shouldn't be, or that we're not doing something we should be. And it's a significant issue in healthcare, where the interoperability of health information, the technology is likely not going to be the biggest problem that we face.
I've heard about these examples before, but every time I hear them, I'm just so surprised and impressed. Denmark, Norway. How did that come about? Maybe politically? I wonder if you have any insights there. And John, similarly, you got a model, you got a solution. What are the hurdles do you think we face here, both practically and politically, to implement something like that?
So I think that, someone, maybe Brian mentioned that there are, the federal government is actually way out ahead of this in the sense that they are trying to encourage people to work from home. And so my understanding is that lots of employees of statistical agencies have remote access to confidential data sets if they want to work from home. And contractors generally also have that access. Researchers typically have not been given that access, although my sense is that's a very, that's not like a grand plan from above. It's just that, like, on the ground, the manager in charge is not comfortable with that. And so I think that, kind of perversely, the thing that's going to drive that along the fastest is when the funding dries up and they don't have a place to put you at a desk. And so this is like the only last avenue to let you continue to have data access will be to let you VPN in from your office. But I think that just building a relationship where they understand that you are no more likely to go do something crazy with it than anybody else who's working with them is important. But I don't think there's some grand limitation on this.
If I could just add to that. So it is not uniform, and this has been a more recent development. So the National Center for Health Statistics, no teleworking employees are allowed to access SIPC data from home. If you want to run your data analysis, you have to be in the office. Census is a more recent that has actually pushed people more to allow that. So it's spreading in there, but it's the discretion of the agency, it's the sensitivity of the data, it's the technology, it's the lots of things.
I don't know if were you also asking about how it was possible to build such systems where the data were actually there, or only about the remote access part?
Yeah. It's kind of amazing that came about, and again, we don't have much trust for the federal government here in the U.S., and so when you see something like that happening, it's like,
Yeah, well, I think this has historic roots because other European countries do not have similar registry systems, and this was developed mostly right after the Second World War, from the 1950s onwards. And I don't think it would have been easy to develop such a system today, but since all these countries see that it's a major advantage, probably the major advantage when it comes to research and research collaborations internationally. And it's the reason why both Denmark, Sweden, and to some extent Finland, Norway, and Iceland also are doing very well in research.
I agree that a lot of this must come from the historical accident that there's one statistical agency instead of 13 or however many we have in the US. But there must also be something beyond that. Correct me if I'm wrong. In Norway, everyone's tax return is posted on the web. That's right. So that happened like 10 years ago, 2001, something like that. So, that's a level of transparency. And my understanding is that that is actually not how most people get access to the data, because you can look someone up very easily, but it's like a pain in the ass to actually get it in a data set. And so it's much easier to just go to the statistical agency. So there must be something different going on because, fragmentation aside, I don't think we're going to see that particular one anytime soon.
No, but that happened about 10 years ago, but it lasted only a few years. Now you can still access anyone's taxes, but you have to, it will be visible to that person that you did it. So that has limited the amount of people accessing their neighbors' tax returns.
Whether or not you have to tell them or not, my sense is that we're still in some other planet than where we are here.
I'll say though, ironically, the Europeans have a data protection law that far exceeds anything we have in the U.S. It's sweeping, it's comprehensive, and the new general data protection regulation is going to take that even a step further. And so we have nothing even comparable to that comprehensive privacy. So it's a bit ironic that there's this transparency on one hand and this really aggressive data protection and privacy law on the other.
And that was going to be my follow-up question. Have there been any breaches in Denmark or Norway?
Well, it depends on what you're asking about. But when it comes to research use of registry data, there have been no breaches of privacy that have been identified. Not a single one. There have been breaches of regulations because the regulations are quite complex. So, for example, if you forgot to fill out that form at that exact moment, and those have been cases with enormous media attention, they've halted research, etc. So it's not that it's strict, but there have been no breaches towards individuals' privacy.
In the U.S., my sense is that the breaches that everyone has cared the most about have come from things like some contractor is in charge of revamping some data set, has absolutely nothing to do with research, and he has a laptop with a CD with individual information on it, and he leaves it in the luggage compartment of the bus, and it's lost for 3 days, and whether or not, and it's, encrypted on the CD, but like that type of thing is the level at which, that happens once and then research gets shut down for a couple of years. I think that happened in 2005 or 2006 with the IRS. So. But it's not some form of actual, like somebody thought about it and there was actually some real breach.
Okay.
Well, I'm sorry.
Oh, no, go ahead.
Can I add to that? I think that if you're really interested in someone's individual data, there's no use in going to the registries. You would go to patient record systems, and they are also electronic and they can be hacked. So that has to do with the primary use of the data.
Wouldn't you go to Google?
By the way, we've actually used that argument with the Office of Civil Rights and HHS in the U.S. with respect to research, saying that we have largely de-identified, anonymized research data sets that are derived from health records, where if we're doing records-based research. And so, why would someone target our de-identified data set to grab it and then re-identify it rather than going directly at the hospital systems that are probably less secure to begin with? So, I mean, that research argument, that again, it's a tough argument to make, but it's absolutely true.
Well, we want to thank you, especially for taking time away from your fields to join our field and help us think through these issues in the education context. So thank you. And I'm going to turn it over to Susan and David.